Hello friends, welcome to all of you. Today we will discuss various specific clinical features associated with some diseases causing cough. It can help you diagnose properly and manage it in a better way. So let's start. If patient repeatedly need to clear throat, sinus symptoms are there and post-nasal drip, there are chances of nasopharyngitis or sinusitis. Cough dry to productive, onset as acute bronchitis, fever may accompany the symptoms. This is a typical scene for community acquired pneumonia, and if it is associated with flu-like symptoms and sputum is little blood tinge, suspect for atypical pneumonia. Sore throat, running nose are commonly associated with tracheobronchitis. Chronic cough with sputum production for consecutive more than 3 months lasting for more than 2 years is due to chronic bronchitis. Copious purulent sputum production since long is a main feature of bronchiectasis. Foul swelling sputum production with high-grade fever is typical for lung abscess. Increase in sputum production or change in sputum from mucoid to purulent is indication of exacerbation of underlying chronic pathology like chronic bronchitis or bronchiectasis exacerbation. Bronchoria means sputum production more than 100 ml per day is common feature of bronchiectasis and chronic bronchitis. Sometimes empyema ruptured into the bronchus can lead to bronchoria. Croup in children and laryngeal palsy can cause barking cough, and Brezig cough is typically associated with aortic aneurysm. Pulmonary embolism typically presents as acute onset cough, mostly dry, sometimes scanty hemoptysis is there, and acute onset dyspnea. Dry cough, more in lying down position, is a typical feature for left-sided heart failure. If cough dry to productive with intermittent hemoptysis, it can be bronchogenic carcinoma. If sudden cough started with evidence of asphyxiation, there is strong possibility of foreign body in the upper airway. But if foreign body lodge in the lower airway, it causes persistent dry cough and localized wheezing. Persistent cough with or without blood-stained sputum, low fever, it indicates some chronic granulomatous infections like TB or fungus. But persistent dry cough, long-standing dyspnea associated with clubbing can be due to some ILDs or lung fibrosis. Smokers' cough commonly seen in chronic smokers is dry to productive cough and more in the morning hours. Dry cough followed by meals, heartburn, sometimes sore taste in the mouth. It is a typical feature of GERD. AC inhibitors induces dry cough and it can present within few days to years of starting the drug. Barking, hawking cough, but generally not during night. It's a habitual cough or psychogenic cough. So friends, that's all for today's video. Hope you enjoyed it and it will helpful in manage your cough patients properly. Thank you so much. Please do share, like or comment on the video and subscribe to our channel. Till then, goodbye, think less, do more and always be happy for being healthy.